Hey, everybody, welcome. Welcome to our good news segment. And by the way, this is a good news segment. For many of you, you've heard me talk about my favorite uncle who one day he looked like the pillar of health, and one day he suffered a massive heart attack. And so for many of us, we scratched our heads back then because we didn't have what we have today. We didn't know what Dr. Charles Davidson is going to talk with us about today. The advances that have been made in treating heart disease are pivotal. You know, we used to look at this as a fait accompli. Now we look at this and we have information, advancements, innovation, technology, and I get to talk to people like Dr. Davidson at Northwestern Medicine so that we can look at what cardiovascular, that word means in the 21st century. Dr. Davidson, it's great to have you. Welcome to the show.
Thank you very much for having me here today.
Probably doing a lot of these interviews. It's a very important topic. But I want to ask you a very specific question. Several decades ago, when my uncle passed away very suddenly, when my mom passed away in 1992, pretty much the way it was described was her heart exploded. I don't think any of us as family members had a clue. Didn't understand what it was about, didn't understand the symptoms. That was then, this is now. What have the advancements in understanding what great heart health is, what heart disease is, what have we learned, and what are you all doing to bring the conversation even further forward?
So thank you for that introduction. The important advances in treatment of coronary artery disease in particular, which it sounds like that's what you're describing, is that we really are looking at how to prevent these sudden heart attacks, how to prevent the loss of heart muscle. And what we've been able to do with that, and it's patient education, so it's shows like these, it's just critical to getting the word out. We have treatments and we have lifestyle modifications that can help, but people have to understand what those are and actually take action with that. And so one of the things that is always the simplest thing is smoking. It's just something that we know increases the risk of heart attacks by over 20-fold from those that don't smoke. And vaping, for example, which is being falsely advertised as a safe alternative, really needs to be understood that these carry the same risks with these patients. People with a family history of heart disease need to know what their risk factors are. What does their cholesterol look like? Is a hypertension, if they have high blood pressure, is that being treated properly? If they have diabetes, is that being treated properly? All of these things can affect the incidence of heart attack, stroke, and death. And what we've learned is that we need to be more stringent in the treatment of these to actually get actual prevention. Back in the early 90s, which you described, we were not as aggressive at treating cholesterol or blood pressure. And numbers that we would have accepted then, we would never accept today because we know the impact of these treatments on their outcome. Also, a healthy lifestyle. And out in the Northwest, people tend to be more healthy than they are maybe in the Midwest. But, regular exercise, diet, all of those things can make those risk factors get better and also, in turn, affect your risk of heart attack, stroke, or death.
And thank you for kind of bringing us up to date, because I think that this is a great place for us to really start to really truly understand where we were and where we are today. And that's really pivotal for today's conversation. Let's dig into a little bit of information about this. First of all, we don't talk about heart disease. We don't talk about how to treat the heart as much as I believe we should, or as much as I think we used to. And I don't think that things have changed all that much, but I'm not the expert. You are. How many people are getting are falling into this category of vulnerability, let's say, and where are we with generational differences? So, for example, every time you turn on the news, somebody young is being featured as suffering from heart attack or heart disease. Give us a breakdown of where we are with this today.
Yeah, it's an excellent question. I think what we have learned is that patients tend to ignore symptoms until they're more severe, and particularly in young people, there's a little bit of a denial factor going on there. Also, the fact of an unhealthy lifestyle often starts at a younger age. And I think what we've seen also is there's a more sedentary population that's growing up right now. People are spending more time with, on their phones, texting, iPads, television, video games, and that's going to add to the incidence of coronary artery disease. So to me, it's early detection, early treatment, lifestyle modification, and getting that word out to people that it's really important to define these habits early in life and then carrying those through. It's more difficult for people to pick up new habits, teaching an old dog new tricks at age 50s and 60s. They'll do it if it's a life-altering event, but sometimes they do and sometimes they don't. But 30 years of wear and tear are hard to reverse.
Yeah. Look, one thing I will say, and I don't know if you agree with me or not on this, Dr. Davidson, but one thing I must say is if you are watching TV, you are tuning in to more programs that have to do with doctors, hospitals, and they are number one programs. They're not like the old school doctor shows that used to be, like a doctor in the country. These are like they're taking you into the operating room. They're holding up, anatomically correct pictures of hearts. Are we getting educated that way, or is it a little bit too much Hollywood and not enough of education wood, so to speak?
Well, it does tend to focus on the spectacular and the wow factor. It's not as exciting to talk about, did you take your blood pressure medicine today? Is your LDL cholesterol under 80 now? It's not quite as sexy. It's more of the wow factor that makes it onto TV. I think some of the technologies we're using right now do have a lot of wow factor, and those are for more advanced stages of disease, when valvular or coronary disease but the fact that we don't have to do open heart surgery for valve problems or coronary problems is very exciting. But that does make it to TV. But some of the early prevention discussions are obviously not what Marcus Welby was talking about, 40 years ago.
Yeah, right. And by the way, if you do happen to watch The Good Doctor, not only do you get to see what's going on, but they put up like a digital blueprint of it. So, the other day, heart valve disease was a topic. Let's talk about it. What are the symptoms? Because, many of us in my family, we have beaten our heads up against the wall trying to figure out if we could have done something different, especially with my mom and my uncle. They didn't look like candidates, right? So can we talk about the symptoms, and then let's talk about where do we go from there, diagnosis and treatment, so to speak.
Sure. Heart valve disease typically, particularly if it's a blocked valve like aortic stenosis, the stenotic valves where there's not enough blood getting out, typically present with symptoms of shortness of breath, chest discomfort, and can be ankle swelling, fatigue. Those are the symptoms we see. With leaking valves, particularly in the mitral valves connecting the top and bottom of the heart, those symptoms typically don't show up till later in the course of the disease unless the patient is extremely active. So leaking valves are something that require better vigilance and better oversight. But the stenotic ones tend to present with symptoms. And when they do present with symptoms, the first thing that should be done is usually an echocardiogram, an ultrasound of the heart, which will give us a lot of information on how the heart muscle works and how well the valves are working. If it's of a mild or moderate degree of blocking or leaking, then those can typically be treated with medications and some of the lifestyle modifications we talked about, low salt diets and other things. But if it becomes severe and it's symptomatic, then we have to move on to advanced therapies. And what's exciting is that, for example, aortic stenosis, 75% of the patients at Northwestern we now treat with a catheter tube from the leg, no general anesthesia, replace the valve and home within a day or two. And that's been a huge innovation for that population of patients.
We're looking at this and we're talking about it, but this is a very important month. And certainly I want to make sure everybody has more information. Where can people go to find out more? Let's start with that.
So our website, heart.nm, northwesternmedicine.org, has good patient stories, patient education, prevention, diagnosis, treatments that are commercially available, and treatments that are still investigational, only in a few centers in the country. Important for patients to recognize if you think you have a problem or have been diagnosed with a problem and you've been told you need something or don't need something, to often seek a second opinion, make sure that what you feel you're getting is the proper treatment, and then make your best informed decision on your health care.
All right, so let's just take a sneak peek at something that many people think about when we start to talk about, hearts and heart replacement and valve replacement. We always think about the bionic woman. I actually got to interview her. But we think about this. We think about some of the fantastic new innovative things that are happening. Give us a sneak peek on where we are with things like that. Replacement, nanotechnology, for example. I have a friend at Harvard that's using nanotechnology to treat and kill parasites in Lyme disease. So where are we? We talk about the future as if it's like 50 years from now. But I mean, are we like in the future? Like, is it now?
Well, what has been extremely exciting is that we're now doing heart valve repair through leg veins or leg arteries, depending on the valve. In fact, in the last month, I've done two of the very first ever done in the U.S. repairs of a tricuspid valve with a clip. And so these are patients that would have traditionally either had surgery or just been very sick and unable to receive therapies that would help them. The medical therapies are ineffective. So even as we speak today, we're doing early human work with new technologies that can be transformative in the patient's quality of life and hopefully in their mortality as well. And these are really being developed, as you said, as we speak. These are going on. What's been exciting for us in the United States is typically a lot of this early work was being done in other countries, and we were a little slow to adapt here. And what we've seen is a real transformation with our FDA in trying to get technologies available to patients in the U.S. earlier on. And we think that's helped in benefiting the patients and hopefully in moving the technology along quicker to help more patients.
I love it. I know you've got to run off to a full day of interviews and conversations. I want to ask you this question. As you speak to our listeners and we talk to them about what is in their control to do, lifestyle changes, other kinds of care for the heart, having spells that cause you to feel dizzy, what would you say to our listeners? What would you say to them today to say, look, this can be prevented, but I recommend that you do A, B, C, D? What would those be?
So I would say if you have a family history of heart problems, you should receive a full screening evaluation. That goes without question, whether it be heart valve disease or heart artery disease. Make sure that you've had a full evaluation, probably been seen by a cardiologist. It may not be that you need regular visits, but let's get a full evaluation. If you've been diagnosed with a heart problem, let's do the risk factor modifications that we've talked about: smoking cessation, diet control, cholesterol and hypertension management, good exercise. All of those things should be thought about. And if you've been diagnosed with a problem and you know you're in a more severe zone and you may need treatment or not, and you're trying to decide on what that treatment is, to make sure you've had all the informed decision presented to you by hopefully multiple providers, and you and your family make what you think is the best decision for you at that point in time.
Wow, thank you. One last question. What's your personal message? What would you like to leave us with today?
I'd say that it's a very exciting time for heart disease as far as helping people live longer. There's a great opportunity for people to live into their 80s, 90s, and beyond at this point in time. And I just want patients to be as well educated and be as informed as possible so that they can participate in their health care.
Wow. I want to thank you. Thank you so much for getting the word out there. And again, hit us with that website.
It's heart.nm, northwesternmedicine.org.
I love it. Let's take a short break, everybody. Lots of information. Please go find out. Please get educated. Please get informed. We'll be right back.